Good evening, this is Juan Catamayo, JCT for Education for you. And we're back. We're back with our live series. And today we have an incredible topic, something that I've been waiting for the longest time to talk about it. And today is the time. So today, I'm very happy to introduce our dear friend and colleague in Panama. And you will see that very soon. Her name is Elisa Villalaz. And Elisa is a leading expert in Latin America for autism. So without further ado, let's invite her over. And I want to say thank you to everybody. Ana, Kata, Christian, and Elisa, here you are. Somebody else sent me a request. Who is it? Anna. Hi. Well, a lot of people saying hi. Samuel, let me invite Elisa right now. And let's see. How is everybody doing? A lot of countries in Latin America, there is a day off. No, certainly here in the United States, a lot of universities were open. Annalisa, hola.
Hi, hola.
How are you doing?
I'm doing really good. How about you?
I'm doing really well. I was just telling our viewers that today is a regular day. We didn't have a day off. We worked here in the United
Mhm.
States. Well, how about in Panama?
Oh, we're working like the whole day.
all
Yes.
all day. And I know that you just finished a consultation with one of your patients. So thank you for being here today.
Thanks for your invitation. I love to be here and to share like a lot of information with everybody.
And thank you to our friends at the College Living Experience, Sandra Soriano, for referring, for putting us together to talk. And today we have an incredible topic. We will talk about autism. You're a leading expert in Latin America. We have a lot of questions for you. So let me do a small intro about you. Very soon, you will be getting your PhD. You will be called a doctor, Dr. Villalaz. Where is the
Yes.
PhD from?
It's from Atlantic International University. I got a scholarship from them because I give a lot of support to my community, and I have created a new methodologies of how to work with my patients. So that's why I got it, and now I'm ready to graduate like very soon.
Good. So Dr. Villalaz, let me continue with the presentation. Full clinical psychologist, psychotherapist. You have actually a lot of experience with nutrition, and you actually got your psychology degree from University of Panama. Un saludo muy grande para todos mis amigos en Panamá, Balboa Academy, International School of Panama, Panagringa. Un abrazo para todos. Also, you received your master's degree from Universidad Iberoamericana in Mexico. And last but not least, and now you're doing your PhD, but you did your studies at the Institute of Nutrition in New York City. So that comes together really, really, really well and handy, and we will put everything together. Your experience is unbelievable. Diagnostics in autism, depression, anxiety, bullying, and all kinds of cognitive behavior. So, Annalisa, we have a beautiful hour, a lot of questions to ask you. First and foremost, how are you guys doing in Panama?
Fortunately, in this moment, the quarantine have been changing, and most of the people are working again. Like people have been able to go out of their houses, and we're like everybody's taking care, a lot of care of each other. But it's like a new opportunity. We stay in the lockdown during many months, much more than other countries. But so now
Okay.
we're trying and see what happens and how it goes.
And I'm sure that you have been super busy more than ever before. Am I correct?
Yeah.
And
Yes, correct.
and why
Correct.
is that? Why is that?
Well, the changes from the environment and being out isolated have created a lot of anxiety, and some of our patients who has like diagnosis like bipolar, schizophrenia, or other type of PTSD, post-traumatic stress disorders, like all the stress related with COVID have triggered them, and all the symptoms have been like driving their lives, and they needed like a lot of support. So we have been working really hard. Plus, all the children are at home, and they cannot go to a center to receive support, and the parents were trying to give them therapy at home, which it's not easy. So we have been training parents and guiding them in a way that they can succeed, and they can help their children. So it
What
has
it,
been very challenging.
I know. Let me ask you a question. Somebody asked me, how many Zoom meetings do you have every day on average? What's the number of meetings that you have? What's your preference for technology for your patients?
In this moment, we're using Zoom,
Hmm.
and it has been working really well for us. And I work like 10 hours per day. There's a lot going on right now.
In a consultation with you, how long is it? Is it 50 minutes, 30 minutes, an hour?
It's 50 minutes when people are like on a training or doing like a psychotherapy process
Hmm.
or receiving therapy. But sometimes there's some people who just ask for like 15 minutes call to ask specific questions or to ask for some guidance.
Hmm.
So we give a lot of free consultations on that way, and then we organize them and help them to receive what they need. If they need an evaluation, if they need therapy, and we guide them, or if they need to go in with another psychologist or to go to another center. So we help them like that.
So, so you think that you're seeing an average of 50 patients per week?
Yes. Yes,
Okay,
and
and mhm,
I do have a team, so
okay,
I do have like a bunch of people who works with me. So some of them are like with a patient when I'm with another patient. So
okay.
it's very different. Yes.
Yeah, no, you need to have a team to support all this infrastructure. So what I'm trying to get is like with those 10 hours per day of Zoom, you also need another maybe 3 to 4 hours to follow up
Hmm.
on each case behind the scenes, whether you have
Hmm.
to talk to a hospital or a doctor and so forth. So I just want to put a point that you're a very busy person, and we want to thank you for your time this evening, actually. Um, Annalisa, as JCT for Education, we empower students. We actually help students deciding what career to choose. And a
Hmm.
lot of our students, they start with psychology. So let's go back to your adolescent life. Where did you go to high school, and when did you realize that you want to become a clinical psychologist?
Oh, that's the best question ever. Well, my high school, it's San Agustin, which is a Catholic private school. But I went to school very early, and they skipped me years. So like I jump in the beginning, like a few years, and I graduate when I was 16. So
Okay.
when I was 14, I was
Hello?
hello. Can you hear me?
No, I lost you. I lost you when you were 14, what?
When I was 14 years old, I was worried about university, like what I will
Okay.
study, what I will do. And I went to practice during summer at a Montessori school. And when I was there, they had one student with autism. And I received a training from the psychologist and from the other teachers, and I learned how to manage this kid at this Montessori school. And when I did that, and I saw the psychologist working and what she was doing, and she trained me a lot, then I decided like, okay, I'm going to be a psychologist. So I went to the university when I was 16, and then I stayed there like 5 years doing classes. Our schedule is different than in the States. We do 5 years of classes, and then you work on your thesis. And during the last year, I was invited to work with a team that was working with this patient with autism, and the psychologists were from the States. So I received a lot of training from
Okay.
very important clinical psychologists and institutions from the States, from Wisconsin, from California, from Miami. from the Dan Marino Center, for example. And so I received all these
Yes.
trainings, and then later on I was ready to go to my master's degree, and I choose the clinical psychology. And then like I went to Mexico, which is a great place to study, and I studied that, and then how to guide treatments, which is my favorite thing to do. It's like the recovering process. So then I got my other
Okay.
master's on psychotherapy. Yes.
Okay.
But
Now,
everything began
I
with autism.
that's a really good. And we right now we have a few students that want to go into psychology. Last week I received a phone call from one of my former students. She graduated from University of Miami psychology and economics, and she said, I want to do a master's in clinical psychology. So we had to dig in some research about, because she wants to run a practice in Colombia. So I mean, how to have her title being honored by the Colombian government, and then with
Mhm.
clinical psychology. So I learned a lot last week through the path of going back home and how to get to use your degrees from country to country. So every country has a different regulation. So
Yes.
kudos to you and thank you. I am not a psychologist. I study marketing, marketing, advertising, management. I did everything, but I had the luxury to be trained by an incredible psychologist, Dr. Marsha Glines at Lynn University. She was one of the disciples of Howard Gardner at Harvard University. So we at Lynn University, I remember back in the day and today, their comprehensive support program is outstanding. And that's how I got to learn a lot about working with the students with some learning differences. And I'm so excited about this topic because there are a lot of parents out there asking me. I'm not qualified by no means to say what's the difference between autism and an Asperger. So let's deep in. Can you help us answering that question?
Yes, for sure, for
Thank
sure.
you.
We use a manual to work on the diagnosis, and there's something very special that I want to mention in this moment, because there's a group of people who are against diagnosis, and there's another group of people who are agree with the putting labels into other people. And I would like to say out loud, like, what's my position? And the truth is, like, for me, when somebody has a diagnosis, then they can access to the right services because they
Okay.
know how to find the right professional who's going to give you the right therapy. So a few years ago, this manual, DSM, it's the name of the manual, um, was putting Asperger's like inside of autism. It was
Okay.
like some a diagnosis that was different than autism. But then later on, because of the increase that we have with the statistics and the cases, and now it's really high, and you can check on that on the CDC information, then they decide to talk about a spectrum. So there's a spectrum that it's called the autism spectrum, and then you have in one section, like the ones who are have severe symptoms, others like, well, like mild symptoms, and then the ones who are like very the symptoms are not that intense.
Okay.
So those ones are the ones who before were called with the label of Asperger's.
Okay.
And this creates like a lot of problems in between the scientific community and for the patients too, because the ones who had that diagnosis called Asperger's, they will say they were Aspies, and they had like groups and teams, and there's like a whole movement related to that. And then now, like, it disappeared, like it doesn't exist. The diagnosis doesn't exist anymore. So with those changes, what had happened is like it's very easy to organize the information and to establish like what the patient is going to need.
Okay.
because of the intensity of the symptoms, because
Okay.
all of them share the same symptoms.
Okay. Okay.
Asperger's plus autism, it's the same.
Okay. So I want
Mhm.
to stop by and just say hello to our audience in Colombia. We have some people from Belgrade that are saying hello from the United States. We have people jumping in and out. Everyone, we are with Dr. Elisa Villalaz. We have the topic today. We're going to be talking about autism. And here we have my friend Betse. Vesna, you are close to me. So if you're close to me, give me a call. I know our friends from Belgrade. So, question for you. For
Mhm.
instance, I am dyslexic, and
Mhm.
no one found my dyslexia until I was in college. And that was third year in college that at the learning center, the writing center, they say, let's run a test because I think there is something going on with you. I'm like, I'm sure there is something going on. And what a student took 50 minutes for an exam, let's say macroeconomics or history or philosophy, I knew the content, but I knew English is my second language, and I knew I needed extended time. So I came a late bloomer. I got my test done when I was 21, 22 in college. So at what age do you start recognizing those cognitive patterns on students, and whether it's in middle school, what are the ages, and is is the teaching the teaching instruction, are the teachers qualified to spot something, so that technical behavior that is going on?
Well, now we can identify it since they're babies.
Okay.
When they're 1 month old, 3 months old, or if it's different type of diagnosis related to the learning process, as you mentioned, dyslexia,
Mm-hmm.
around 4 years old, 5 years old. But everything before 6 years old, it's the moment, it's like you have different critical moments, and if you can help the person when they're really young, the brain, it's very immature, so it's very easy to move it, and you stimulate one side and the other one gets activated, and the reaction is really fast, so kids
Okay.
can recover faster than if you find out somebody when during adulthood, like your experience, and that's a very different situation. Like a person who received a diagnosis, have stayed like 12 years at school, suffering because this and that, without understanding what's going on with them. Sometimes the it goes down, like all the emotions of the person gets depleted or depressed, or their self-esteem just goes, they can have like low self-esteem just because feeling there's something wrong, but they don't know what's going on. And it's not that there's something wrong, but it's like
Mm-hmm.
something, it's not working, something, it's, I can't do it, like why I can't do it like my friends and like the other people that I have around.
Yes.
And so now what we recommend to the parents is to check on your babies, make sure that developmental process is happening in the right way, make sure that they receive the right stimulation, because on that way then you can support them like 100%, and you can help the brain to make all those changes before they're 6 years old. So when they're ready to write and read and go to school, then they're not going to have any troubles. So
Okay.
early interventions, early detection, it's the best thing.
So let's just
But
stop there for a second with early intervention, early detection. Okay, so let's talk about Panama, let's talk about Central America, let's talk about South America, North America. How do you detect that? I mean, that's my question. Are teachers qualified, kindergarten teachers? How do you spot it? I know parents would say, there is something going on, but you mentioned as early as 6 months old. So, what are the cognitive behaviors that the parents are needing to watch or look out for?
Mhm. Yes, the first thing is that when you have a baby, when you're breastfeeding the baby, or even it doesn't matter if it's a natural process or you're buying the milk at the supermarket, you do a lot of eye contact with the baby. So when
Okay.
they're 1 month old and they're very, very, very little or very young, they cannot maintain the eye contact. Their
Okay.
eyes are like dancing from one side to the other. But with the time, when they're around 6 months old, then they can stay focused. They can look at you during a longer period of time. So their attention span begins to increase, and then
Okay.
they can pay attention to different things. They can look at the fan, they can look the light, they can look to a toy, they can look at you for a while. And then if you call them by their name and they're 8 months old, they will move around and they will move, they will recognize that's their name. But then when there's a baby or a kid with autism, they're 2 or 3 years old and you mention their name and they don't react. They don't
Okay.
move their head. They don't pay attention. If you try to look at them to the eyes, they do not want to do any eye contact and they're
Okay.
not interested about that. And this is a sign that it's very clear on autism, but if you see somebody with deficit attentional disorder, like it can happen too. Like
Okay.
sometimes they cannot stay paying attention to one thing, so their eyes are just moving everywhere.
Okay.
But look at this. Look why it's so important right now to learn about autism, to understand autism, and to be very respectful with a person who has autism. If you check on the statistics, you ask about Panama and the other countries they have around, and we do not have very specific statistics here.
Okay.
But if you check on the CDC from the United States, you will see that 10 years ago, 15 years ago, there was one case every 100,000 or 10,000 and
Mm-hmm.
of children, but now it's like one every 64.
Correct. Correct.
So so it means it's really high. So there's more people with the diagnosis, and there's, well, of course, nobody knows exactly why this is happening, and there's a lot of research related to this. And there's some people who have their explanations, and they have like the if it's a genetics, if it's problems on your intestines, if it's problems, neurological problems, a developmental disorder. There are different approaches and different explanations. But the truth is that when you go into adulthood, for example, if you work at real human resources and you're doing an interview to somebody who want to work in your company, if you don't know about autism, you're not going to be able to distinguish that this person could be really smart, have the education that you need to do the work, but if they don't do eye contact because they don't like it, they don't
Yes.
enjoy it. So you can stop giving an opportunity to somebody else just because you don't know that if there's a little bit of autism, they're not going to be doing eye contact. And usually when we see people without eye contact behaviors, we think that they're shy or they're depressed or they're not interested or they're disconnected. But when we're talking about autism, this is just a symptom. So when you have a baby, it's very important to spend time with the baby and teach the baby to look at you. And if you got a baby who is 6 months old and you talk to this baby and you try to look at their eyes and they're always avoiding your eyes, like they're always like looking around like this,
Yes.
you need to run and ask to a pediatrician. The ones who are their specialty is around neurodevelopment,
Okay.
because there's something going on,
Okay.
and as soon as you find out there's something happening, you can help those kids immediately, and then you can do a huge difference in the prognosis. Like it
Okay.
makes a huge difference. Yes.
Okay. There
So
is.
eye contact.
Okay.
Oh, sorry.
No, no, eye contact.
Eye contact, when you call to their name, that's the other thing. Use their name. If they do not react, you need to be alert because there's something going on. And the other thing is the delay with the language. Like
Okay.
they're 2 years old and they don't say mom or dad or water,
Mm-hmm.
and then and you need to be very sharp and ask for support so you can teach them how to speak and develop the language area.
This is fascinating because you mentioned there is a lot of research happening as we speak of what's the cause of the spike on autism. And I was just thinking, I have had conversations about vaccination, could be one of them. When you and I were born, we just had a few vaccines. Nowadays, the amount of vaccinations has increased tremendously. So there is a big discussion, should I do it? Should I not? Nutrition, the gluten, we see more sugar on our meals for the kids. We see things that they shouldn't be eating. Like you and I, we raised with natural juices, and we didn't have a lot of, the substitute meals that there is today. Chicken nuggets. I don't think you and I had chicken nuggets for the longest time. We had chicken, and it was probably organic chicken. It was a farm-raised chicken. I was thinking
Yeah.
something else like technology. We have technology. We have parents that they don't have the time to be at home, so the children
Mhm.
are just being raised by Grammys, by nannies, by somebody else. And there is another factor here, and I'm sorry for putting you on the spot, but I need your help. We have families that do not have the financial means to pay for a psychologist. They cannot even afford their health care. So what happens with all these the vulnerable families that are at disadvantage economically, and they can't even figure it out? What's your recommendation for that population?
Hmm. Well, the first thing is that we always say that we need to learn to live in the way our grandparents did. So if you have any difficulty with your health system, if there's something, if there's any disease, if there's something wrong, like just go back into natural. So find the special people who can guide you of how to reorganize your nutrition, how to reorganize the way you eat, the type of stuff that you're eating. Make sure that you sleep well. Make sure that your children are sleeping enough hours in every night. And then make sure that even if you cannot be with them at home, that there's messages or things that you give them so they can have those things close to them during the day so they can feel you closer. Because the mind and the cognitive process of children are different than from adults. So because if it's different, the way they experience things, the way they understand the experience are different than an adult understanding. So there are many different tricks that you can just, or little things that you can twist, and for them has like a huge meaning, and you can make sure that they feel your company, that they feel you're there, that they don't feel alone. And that's a very important thing to learn. But when we're talking about autism, one of the biggest difficulties is that these children or adults they're not interested about being with another person. They're
Okay.
not interested about being engaged with the interests or the things that other people are paying attention to. So it requires effort from other people to get them to be engaged in something else.
Yes.
Um, so if you ask me, like, what should I do if I realize that my kid has some symptoms? The first thing I'm going to tell you is just like, okay, you have to breathe, put your right hand covering your heart, close your eyes, mhm, and just inhale and exhale through your mouth, and do it again. Inhale through your nose and exhale through your mouth. Yes. And when you open your eyes, make sure that in your heart you can feel that you are going to help that person, you're going to help that person with autism, because now there's a lot of support. It's not like when we grow up. Now it's very different. There are a lot of techniques, there are a lot of medicines, there are a lot of diets, there's a lot of different type of treatments, of therapy, of different type of interventions. And when you said autism now, it's not the same way as 5 years ago or 10 years
Okay.
ago or 20 years ago. There's a huge difference. And this week I have been reading a book from a clinical psychologist, but she's 92 years old.
Wow.
And she wrote a book called The Gift. And
Okay.
she mentioned that during her life, she survived to the Holocaust. And she's
Okay.
talking about her life and how she recovered from post-traumatic stress disorders. And she said, like, the only reason why you don't feel hope, it's because there's ignorance
Okay.
in there.
Okay.
So if you're open to learn, like what to do, how to do it, what can I do, then the hope in your heart, like it's going to grow, and other things are going to are going to show up, just because you're open to learn about other people, about the experience of other people, and then you're going to be able to help your children or your child to stand up, to continue to recover from autism, or to live with the condition, or to receive the type of treatment that he needs. It doesn't matter if the symptoms are severe or not. And
Yes.
that's a very important, um, I think that's the most important learning process
Okay.
for everybody. Yes.
Okay. Now, last week you noticed that I put the cooking show. I wanted to put a wellness program. This is the time of the year applications are due for our students that are graduating from high school. The ones that are going for graduate school, parents are going super busy. There is no time, and I said, let's create a wellness program, and that's what I did last week. I had so much fun. It was an hour that I forgot about all my problems, everything that I have to do, and I have a lot of good. It was a great time. But you noticed that I cooked, it was gluten free of what I did.
Uh-huh.
And I
Yes.
know you have an incredible background on nutrition. You went to the Institute in New York City for Integral Nutrition, which is very well known around the world. And nutrition is a very important side of what you do. Tell us why.
Hmm. Well, look how interesting. We all, since a few years ago, we all understand that our body works in this way. The
Hmm.
brain controls the rest of the body. But then a few years ago, some people began to say like, oh no, the brain it's living in our intestines. And from there, the information goes into the brain, and then the brain is the one who controls the body. So you need to take care of your intestines. And then other people began to say, well, it's not the intestine, it's the microbiome, it's all the germs, all the bacteria, like all the things that live in there, that are working with the food and getting out all the vitamins, the nutrients, and everything, to put it on the blood and then send it to your brain, and then the brain it's able to do this and that. And it has been so interesting to see how usually kids who have autism, or who have received this diagnosis, they do have problems with their gastrointestinal health. So they're very picky, like we say here
Okay.
in Panama. Like they only want to eat, like one of my patients, like he only eat fried food. If it's not fried, he wouldn't even try. There's
Yes.
another one who only eat like red stuff. So you have to put ketchup everywhere, because if it's
Wow.
red, then he will eat it. And now, like, there's a lot of research that have shown up that if you clean up your system and you find out what's missing in that microbiome, and with all those bacteria, and you replace that, and you put a lot of vitamins into the food that the person is eating, or if they take supplements, and this all these vitamins goes into the body, then the body begins to work differently, and that makes the brain to work differently. And when we talk about gluten, there's a lot of research that shows up how the reactions of somebody who has gluten is the same one as somebody who's taken drugs, and are the
Wow.
same areas on the brain that gets activated by the gluten. So have you ever seen somebody who's drunk, for example?
Yes.
They cannot do eye contact, right?
Yeah, correct.
They cannot speak.
Mm-hmm.
They cannot move their body, like they lose balance, right?
Yes. Yes.
It sounds like autism?
No.
It's a, it sounds like the same symptoms.
Okay.
There's no eye contact. They cannot
Okay.
speak. They cannot think. They cannot control their body really well. And then they began to do all this research, and they realized that it was related. So
Okay.
now that's why everybody's saying like gluten-free and casein-free. But it's
Wow.
important to do a test to make sure that that's happening to you, because if you do not have that sensitivity, then it doesn't matter if you do the diet or not, because your body is not in that situation. But when we're talking about autism, that's the first thing that everybody needs to do. We do have patients who have not done any therapy, and they just received the diagnosis, they stop the gluten and the casein, and 2 weeks later, the child are talking without having any other intervention. So
Yeah.
it's a detox process.
Oh,
Yes, yes.
no, and that happens in my family. One of my relatives, they suspended all the gluten, and boom, her cognitive level went up, her grades went up from C to A's. I mean, her concentration level was impeccable. And you have here Kata saying, well, reason why I don't eat gluten is one of those. And last week, one parent just sent me a message from Colombia and say, thank you so much for cooking this cauliflower pizza because my child is gluten intolerant. So we cooked that and did a vegetarian one. They loved it, and that's the way to go. So here are little tips and secrets that we can teach our population. So let's move on
Yes.
with autism. Um,
Now,
so we are saying this is the population keeps growing and growing and growing, and we work with high school students. That's my primary job. And when they come to our practice, I'm like, something is cooking here, and it has been undetected. Many reasons. So we recommend the families to have a psychologist run a full psychological evaluation. Would you mind explaining what a full psychological evaluation is, please?
I would love to explain that. There is a group of tests that the psychologists are going to apply, and all those tests are going to be measuring the emotional area, and they're going to be measuring the mental processes. So all
Okay.
the cognitive processes, all the processes that are related to the way of thinking, the thought, the memory, the organization of your system, like how do you organize information, how do you recover the information from the memory. So there are specific tests for all those areas, and then when you got all the results, you can put all together and get into a conclusion. So then you know exactly what type of support that person needs during a specific time to be able to rebuild or to develop the skill.
Okay.
And that's why I was mentioning before, like this group of people who are not agree with diagnosis and the ones who are agree, and that there is a whole thing in between that. But the truth is, like, if there is any way you can understand and you can find out like details of what's going on, you're going to receive a lot of benefit. Because imagine if I tell you like, oh no, you just need to stop eating because something, it's not helping you. There you have a problem with something. Like, you cannot do that. But if you get a test, or if you do a practice and you realize like, oh, the gluten is hurting me, then you keep eating everything else, but you work on that issue with the gluten. It's the same thing with those evaluations. Then in the results, you realize like where it's the problem, how it's the problem, what's the intensity of it, and then how you're going to be able to help the person to rebuild this area or to develop the area or to focus, or maybe you need to go to a psychiatric or to a neurologist because other things can be happening on the brain, on the body. So it's very important to do those evaluations, but it's always go with a positive attitude to those evaluations, because you're not finding a problem. You're searching for a solution, and you're searching what type of information you need to know to be able to help the person.
Okay.
And it's very interesting that you work with that that population, because when you finish high school, it's a moment where life gets like completely on your hands. It's like, okay, so now what I'm going to study. And if you can go with your strength, whatever you go, whatever career you're choosing, that makes a huge difference in life.
Yes,
to take the
yes.
right decision. Yes.
So I was trained at Lynn University for 12 years on picking that cognitive behavior. I've been an educational consultant for 9 years, so it's 21 years. And my question is, when I find there is something is not clicking, I am like, okay, we need to run a full psych evaluation. We refer them to couple psychologists here in Miami. And the families, they're, for the most case, they say, you know what, I will follow your lead. This is why I hired you. But help me out, how, when parents that get the feedback and the diagnosis comes back, sometimes it's devastating news for them. And despite how much I tell them, I say, don't worry, there is support services. My question is to you, how would you support families once the evaluation is back and there are recommendations to the family? What's your answer to that? How they need to cope with the feedback coming from the evaluation?
I think it's very important to, when they're receiving the information about the results, that the professional needs to be a heart-centered person. So it will be very careful in the way they talk, how they talk, what they say, how they say it. And at the same time, the psychologist is going to say what we found and how we're going to fix this. Fix, I don't want to use the word fix. Maybe if I'm speaking in Spanish, fix will be the word that we use, but in English it sounds weird. But for example, if I need to tell you, well, he got a lower IQ, so that means that his levels of intelligence are not high enough to go to the university, or this type of university, for example, or this type of career. Yes. Then you tell the person immediately what we're going to do about it. So we found this, and what we can do is to take him to this kind of therapy, or taking him to this other type of university, other careers. And it's very important for the parents, like when you go into the first session, to feel like a good connection with the psychologist. And I can tell you, because sometimes it happens to me that the patients come and they have visited other psychologists before, and they're hurt by the professional because of the way things were mentioned or explained. And so I always tell my patients, and I talked about this out loud, it's like, make sure that you feel comfortable with the professional, with the psychologist or doctor, but make sure that it's a heart-centered person. It's because that person is going to take care of your heart, and when they give you the information, they're going to support you so you can succeed. Because the idea is to find, but to get the solution, to help the child, to help this person who's going to go to the university. That's the intention. So it's important for the parents. And there we go, and it takes me to the book that I'm reading in this moment, because she mentioned many times in the book that we lose hope, or we don't feel hope, when we don't know. We don't know how to resolve it. We don't know what to do. Like if I hear, oh my gosh, it's autism, many people, when listen autism, they think there's nothing they can do. And unfortunately, there are doctors who says, or pediatricians who says to the patients, like, there's nothing. They're not going to be able to speak. They're not going to be able to go to school. And that's not true.
Okay.
The truth is like if you get information, if you get like the information that you need to help the child or the
Hmm.
adult, or then that person is going to succeed. Like,
Of course.
and then, and yes, and when you mentioned the dyslexia when you were an adult, what I felt is like, oh my gosh, I hope that when he was growing up, the other people didn't bully him. That was
Yeah.
my first thought for you.
Yeah.
Like, I hope that somebody holds you emotionally while you were growing and during your maturity process. So then when you get into adulthood, other resources can show up, because when we what we feel, and what I feel and what I want is like, if there's something going on, let's take it as a challenge.
Of
It's
course.
just like, go for it. Okay, let's try. It doesn't matter how many times you need to try. Somebody with an autistic kid who went to my clinic, she said like he was like 1 year and a half, and she said like, if he's gonna be able to talk? And many times we do not know if the treatment is
Okay.
gonna work or not.
Okay.
But I said like, okay, ask me that question in 10 years.
Okay.
We're going to do it this during 10 years, and then let's look back, and then we will see if we were able to make it happen or not. So we shouldn't begin the fight thinking that we're going to lose the fight.
And let me tell you, I can give you some good news. I've been in education for 25 years, so I have
Hmm.
seen the full spectrum. And most of the cases that I work with, their success. We had a student, a graduate student at Harvard with extended time. We had a Boston University, Villanova, Lynn University, University of Miami. We had so many students with support services. It's just that they don't disclose it to anyone but the learning center, and that's what we do. There are so many tools to help students nowadays and adults that people don't know, and that's why they come to professionals like you, myself. We tell them, don't worry. The good news, in high school, I didn't have a choice, and I didn't know. I said, okay, my choice was to become the most popular person in the school, so I don't get anybody to any bullying. But there, like you, kids, they surround with these armors where you have different patterns, and that's how you protect. And then you negotiate with the teachers, you smile and say, but never knew that I was dyslexic until my third year in college. So that's what I
Hmm.
love my profession, because I will say I level down and I say, listen, there is something going on, and I wish I had that support service when I was in high school, and I didn't. So let's find that out early. But the answer comes when the family finds out, the parents find out that there is support services needed. They are like, oh my gosh, this is so bad. And I tell them that's not bad. We are
Hmm.
all wired differently, and we all think differently, and all styles are welcome. And the world
Hmm.
is moving towards all styles are welcome. So do not worry, but let's figure it out. So that's
Hmm.
something. Now, that evaluation comes very expensive here in the United States. A full psychological evaluation can run between $700, $500, all the way to $5,000. How much is it in Panama?
Well, it depends. It depends of the clinician, and it depends of
Okay,
the type of evaluation that you're doing. Of course,
okay,
our prices are going to be lower because our
okay.
economy is very different than in the States. But the truth is like, and other to apply 2 or 3, and that's why the prices change. It really depends of what you are doing for the evaluation. Are you there? Are you there? I lose you. Going on with the internet connection?
Hola, hola.
Hola.
Can you hear me? Can
Now I
you?
can hear, and now I can see you.
Okay. So you were saying about the cost, the price? of the evaluation?
Yes, it's related to the amount of tests that the
Okay.
psychologist is going to apply. Sometimes you need to apply 3 or 4, but sometimes it's like 20. It's a lot,
Okay.
or
Okay.
15 tests, different tests. It depends, and it depends of what you're searching for. Sometimes you begin with an idea, and then you realize that there's something going on, and you need just to go deeper and find other things. And so then it changed. Of course, for us, like the prices are lower because
Okay.
our economy in our country is very different than in the States, so it's going to cost less.
Okay.
Um, but it's that's why it's so important the relationship you establish with the clinician or the doctor who's working with you, because you need to make sure that you feel comfortable and that the other person is really taking care of you, and they're not like just charging money because they're working and they're charging money. It's that they're working doing something that you need, and the cost should be related to the value of the information
Correct.
that
And here
you're
we
going to
have
receive.
Gloria Realtor. Thank you for putting this comment. I believe this kind of person are very smart. I think she's referring to autistic students,
Yes,
and they have very good memory, etc. And you are the
yes,
expert.
but and this is something important to mention. It depends of the intensity of the symptoms.
Okay.
The intensity of the symptoms makes a difference. If you talk with a mother who has, and I just have an interview last week with a mother who do have a kid. Well, he's not a kid anymore, but he's an adult with severe autism, and they need to do electroshocks, for example, and
Yes.
specific treatment at the hospital because he is very aggressive and he could kill somebody. So,
Wow.
like then like there is the other side, it's the side where the symptoms are very severe, and like this family tried so many different things and it was not possible to have changes. Then they realized the kid who had not only autism, it has like he has um bipolar disorder too. So you
Okay.
can have autism and epilepsy, you can have autism and anxiety disorders, or ADHD or ADD plus the autism. So it's related to the intensity of the symptoms. And of course, there's many people with autism that are, but they have a high IQ, they're very smart, they can remember, they can work, they can function like without you wouldn't think they do have
Yes.
autism.
Yes.
But we shouldn't forget that then there's the other side of the spectrum too.
Okay, thank you so much. I mean, we haven't even touched medication, and we have 7 minutes. Instagram lives only give us an hour, but we will touch. Annalisa, you're a leader expert, but you also lead a series of the Global Autism Summit. Can you briefly explain what is the Global Autism Summit and how people can find you out and all the literature and everything that you do online, please?
Yes. Well, I'm working on my thesis for my PhD on clinical psychologist that you just mentioned, we mentioned before. And I'm building up it's a group of online programs to give support to families from the autism community.
Okay,
So the first project is the Global Autism Summit, and this is a free series of interviews with experts who work with patients and people with autism. And it was so interesting because during in the beginning, I was only interviewing like 20 experts, and at the end, it was 40 experts.
wow.
So in that program, like you just have to go to globalautismsummit.com and you sign in, and you can get all the information from these interviews. And there were parents who wrote books, dads, moms, brothers of people with autism, people who do have autism, and now they're adults and they're working and they're working on the field. And then we have the people who are doctors, so this is their specialty, and clinicians and therapists, occupational therapists, speech therapists, and we cover all the different approaches to autism during that
Okay,
summit. And
okay,
there's there's 3 other summits that are coming on the road. We're already building the second one. So we're
Okay.
going to have 3 summits from now until December. And the idea is to educate everybody. And this is a summit that it will be very interesting for other people who do not know anything about autism to learn about autism.
Okay.
Because as far as you understand, and you can see how many people recover and you can see how many different techniques are available, then your hope it's gonna bright inside of yourself, and your heart is gonna get open. And when you're on the streets and you find somebody with certain behaviors like flapping their hands, like moving their
Hmm.
hands like this, then they don't look at you to the eye, so you know, like, oh, maybe this person has autism. That means that you shouldn't touch the person, that you shouldn't speak loud, that you have to be very careful because their nervous system, it's very sensitive most of the times. So like all your compassion in your heart, it's going to show up, and you're going to be very careful in the way you relate to that person so you can help the person
Okay.
the same way you help anybody else in the street that it's just close to you and needs something.
Okay.
So you just have to go to globalautismsummit.com, and you're going to find there the information. And we're having Q&A events, so different experts are coming, and you can subscribe to that event too through the same web page. And this is all free. It's all free. Like, you just jump into the Zoom call and then you ask all the questions that you need to the expert, and we're
Okay.
moving to different topics and
And
approaches.
and I sign up, globalautism.com. And when you have the next summit coming up, send me the information. We will house it on JCT for Education for you.
Oh,
And
thank you.
Annalisa, I'm conscious about time, but I want to ask you 2 brief questions. Look at the timer because at 9 o'clock, they're going to close our time. So the
Okay.
question is, what's the future of education related to autism?
Well, now there's a lot of options and a lot of people working on inclusive proposal, so they can receive the material organized in a way that they can keep all the kids inside of the classrooms. And now, of course, because of COVID, we're not at schools when everybody's doing things online, but they're receiving accommodations with what they need so they can
Okay.
succeed and they can enjoy and learn and go to the university and get a profession and develop themselves as everybody wants to or needs to in this life.
Okay, well, thank you so much. And we have Live Love Miami in Marilyn, we have Gloria, we have Nor, we have a lot of people that have jumped in and out. Remember, everyone, we're housing this on my IGTV, Juan Catamayo. We're also going to house it on our YouTube channel, JCT for Education for you. Last word, my friend, you want to say anything else before we close?
Keep your heart open and learn about autism.
We'll keep our heart open, and thank you so much for your time. Instagram is already telling us the time is over, but Annalisa, Dr. Annalisa, good luck with your dissertation. You're doing a phenomenal job. And to
Thank you.
Mrs. Soriano, thank you so much for introducing the 2 of us at the college living experience. And we hope to meet you soon in person when all of this is over.
Yes, thank you very much. Thanks for having me in your
Th-
program.
Thank you, and have a wonderful night. And everyone, thank you so much for watching. I appreciate your time. Buenas noches.
Buenas noches.
Gracias. Bye
Bye.
bye. Adiós.